This video will demonstrate the protocol for socket grafting with flap reflection using Augma Bond Apatite bone graft cement. For this protocol you can use 3D Bond plus 0.5 cc syringe or Bond Apatite 1 cc as the bone graft and Augma shield for coverage. Watch the following steps from site preparation to closure. The site preparation in socket grafting with a missing wall requires a complete debridement and flap reflection. A vertical incision is performed approximately 5 mm from the extracted tooth and should not exceed the mucogingival junction by more than 3 mm. Reflect the flap by introducing the periosteal elevator 3 mm beyond the mucogingival junction. Please note that in the area where the buccal plate is missing, introduce it as much as needed to expose the entire area. To activate the cement, place the shaft in the palm of your hand and the other finger at the top of the cap. Advance the shaft forward so the saline moves from the liquid compartment to the powder compartment. Continue to push until the first piston reaches the line. The syringe is now ready for grafting. Remove the cap with a twisting and pulling motion. Inject the material from the buccal aspect at a 45-degree angle. Place a dry, unfolded, sterile gauze on top of the graft and press for 3 seconds from the buccal and the occlusal aspect. Take the periosteal elevator and compact on top of the dry gauze for an additional 3 seconds. In order to grow keratinized tissue and preserve the papilla, the flap is not closed. Instead, place the soft tissue directly on the graft. Position the flap in place and suture papilla to papilla. Then suture the vertical incision. When the soft tissue is sutured, protect the exposed graft with Augma shield so that it will not wash out. Use Augma shield to protect the exposed graft. Augma shield has a matte layer and a transparent layer. Trim Augma shield to size so that it fits the defect. The side that is attached to the transparent layer is the side that attaches to the gums. Remove the Augma shield from the transparent layer and place directly above the graft. Without suturing, Augma shield will fall off after several hours. Use non- or slow resorbable sutures and refrain from using fast resorbable sutures such as chromic gut. Suture the Augma shield with a cross-horizontal mattress suture, starting from the mesial aspect to the distal. Then proceeding to the palatal area, from the mesial through distal. Make the first knot. Continue to suture by going through the Augma shield vertically, on both the buccal and palatal aspect. Go back to the buccal aspect, once again as a horizontal mattress from the meatial to the distal. And palatally, from the meatial to the distal. Now make the knot. To summarize, here are the key points for socket grafting with flap reflection protocol. Site preparation. Make a vertical incision that should not exceed the mucogingival junction by more than 3 mm. Reflect the flap by introducing the periosteal elevator 3 mm beyond the mucogingival junction. Cement activation. Push the shaft slowly until it reaches the line. Grafting. Place the Augma Bond Apatite in the site and slightly overfill. 3D Bond plus half cc can also be used in socket grafting cases depending on the size of the defect. Compact from the buccal and occlusal aspect with a dry gauze for 3 seconds and add additional compaction with a periosteal elevator. Suturing and closure. Suture first the papillae and then the vertical incision. Place the Augma shield and secure it with cross mattress sutures as required. Do not use fast resorbable sutures and do not advise the patient to use salt water for mouth rinses.